Hi, my name is Aris. I'm here with Vessel, Sana and the team at the Fetal Medicine Foundation meeting in Mallorca. And I want to talk to you today about creating a core outcome set for fetal growth restriction. Now, what is a core outcome set and why do we need it? Over the last 30, 40 years, there have been a large number of studies, observational and randomized, in fetal growth restriction. And the problem we have when we try and do a pooled analysis of these data is that every single study has collected slightly different things. People define outcomes in slightly different ways. For example, they might define preeclampsia in a different way or use a different chart to create a centile. And that creates a real problem when we try to do meta-analysis or systematic review of such studies. Such a pooled analysis is really powerful, and we think that by creating a core outcome set, which means that everyone has to report a minimum data set as an outcome, would be very, very good. Of course, people will be able to collect anything they want. What we're saying is that in addition to anything you want, you create a set of core outcomes that are unique and common to every single study. So what we need from you is we need your help because we can't do this alone. This is a really important aspect of the study, is that in order to decide what this core outcome set should be, we're going to ask a whole bunch of clinicians, patients, people who've had the condition, and people who deal with the condition every single day. That's the only way to decide what are the important or the core outcomes that we need to collect. So we need your help to go through this really, really important study. So please help us and believe in the power of the pooled analysis, because that's really going to help in our future studies, so that when we have this conversation again in 5 or 10 years time, we're not in the same place that we are today with lots of small studies that are not talking to each other. By having a core outcome set, we will be able to do pooled analyses of all existing studies, which will hopefully one day help us properly understand fetal growth restriction and all the implications of it. So, it's not difficult, it's not time consuming. All you have to do is nothing right now. We will send you, if you're willing to participate, an email link which you click on and just answer some basic questions. There will be more than one round because what we want to do is gain consensus over a number of rounds, but it'll be pretty straightforward and none of the questionnaires will take you more than 10 to 15 minutes to complete. A small price to pay for proper studies into fetal growth restriction. Thank you very much.
All I do is dream of you the whole night through. With the dawn, I still go on dreaming of you.